My name is Jacqueline Adisa, a primary teacher by training, a farmer and a member of Elgon Community Health Cooperative and of Mwaure Women's Village Savings and Loans Association in Eastern Uganda. Our group leader, Oliver Namataka, here with me, introduced to us the idea of joining a health cooperative in March 2020 when the COVID-19 pandemic had just begun. We did not know how the health cooperative works, but what was obvious were the many health-related challenges we faced. Poor quality of health care in public facilities, that is, inadequate staffing, drug stock outs, which push people to seeking care in private facilities, but often the cost is high, which you could not afford, and this led to delay in seeking care due to lack of money. We have the social and economic impacts COVID-19 has had on our activities. COVID-19 has had a lot of effects on our work, but also lives of all our members. Due to lockdown, access to care was limited due to lack of transport to access hospitals, fear to get infected, but also health facilities were overwhelmed due to a focus on COVID-19 care, and some diseases were ignored. Mothers could not access antenatal care, and reaching hospitals for delivery was difficult. The economic impact of COVID-19 affected incomes, and therefore survival became difficult for those who survive on hand to mouth. But the cost of food went high, and families could not afford a proper diet, while others survived on one meal a day. Socially, our children have missed school, and the number of teenage pregnancies went up. Women and men suffered domestic violence. We have challenges that have encountered due to COVID-19 pandemic, and what measures and solutions we have taken in response. Some of the challenges include inability to meet a group, but this was solved by our group chairperson Oliver and other group leaders working with the Divine Health staff to mobilize us house to house. We learned that joining health cooperative would enable us access health care at lower rates and on time. This would in turn keep us healthier with our family members and be able to save some money for other family needs. How the measures and actions we have taken contributed to addressing gender inequalities and the positive impacts they have created for the local community. The gender inequalities were addressed through family approach in the health cooperative work. Each member joins with the family, and this ensures all family members, including men and women, are covered by health insurance and could access care. Throughout this pandemic, we have been able to address and overcome the health economic challenges as members of Mwaure Women's Group, but also entire Elgon Cooperative. Through our weekly saving in our group, we've been able to set aside premium contributions, get some money for other family needs, and women are not depending on their husbands for family needs. Recommendation, we have the recommendations I have for cooperatives at all levels to facilitate a just recovery for the pandemic. There are cooperatives and associations that have been weakened due to the pandemic. I recommend that they should recognize and remobilize members to hear their thoughts on how they can actively engage again. It is also important for a cooperative to provide education, training, and information dissemination, because under a cooperative, members are better protected than when alone. Although our cooperative has managed to start and run without a support, a lot of support from funding agencies to build capacity for sustainability is needed.